Hi everyone, I'm Dr. Manasi, your dermatologist, and today we're going to dive deep into a topic that affects millions: acne. From tiny whiteheads to deep, painful pustules, acne can come in many forms. But here's the thing, not all acne is the same. And figuring out which type of acne you have can not only help you treat it more effectively, but also help you stop wasting money on the wrong product. We'll also talk about common acne triggers, basics for acne-prone skin, and dermat-approved ingredients to help you calm and clear out your skin over time. So let's get into it. First, we'll talk about the types of acne. Now there are 4 grades or types of acne. Grade 1 is comedonal acne. This includes whiteheads and blackheads. Whiteheads are also known as closed comedones. These are small flesh-colored bumps under your skin, commonly seen on the forehead, cheeks and chin. They occur when the pore is clogged with dead skin cells or oil. They are non-inflamed and they don't hurt. Best treated with salicylic acid, chemical exfoliants and retinoids. Blackheads, on the other hand, are open comedones. They are similar to whiteheads, but here the pore stays open. They may be flat or raised, and a common misconception with blackheads is that the blackness is due to dirt, but it's not. It's due to oxidized oil. These are best treated with niacinamide to balance the oil, salicylic acid, retinoids and even pimple patches. Grade 2 are papules. These are red inflamed bumps. They usually occur when the blackhead or whitehead gets inflamed. That's why they are usually tender to touch. However, they do not contain any visible pus. These are best treated with niacinamide to control the inflammation, topical antibiotics under prescription and retinoids. Grade 3 are pustules. These are your classic pimples with a red base and a white or yellow pus-filled center. These are a step up from papules, wherein they are more inflamed, maybe itchy or even sore. These are best treated with benzoyl peroxide, salicylic acid, oral antibiotics and even prescription strength retinoids. Remember to avoid popping them, otherwise they can lead to scarring. Then we have grade 4, which is nodulocystic acne. These are deep acne which may not even come to a head and can be pretty painful and last for weeks. If not treated properly, they can lead to scarring. These are best treated by your dermatologist. Your dermatologist may give you oral isotretinoin, prescription antibiotics, or even other interventions like injections. Let's talk about the common triggers of acne. You might be doing everything right, but pimples still keep popping up. Let's figure out why. So one of the most common triggers is hormones. This may be due to puberty, pregnancy, periods, or even PCOS. If you feel like your acne is coming around your cycle, it may be hormonal. Hormonal acne typically shows up on the cheeks or the jawline. Pro tip, if you feel like you have hormonal acne, track your acne with your cycle. And if you feel like it's aligning, reach out to your gynecologist. Stress. Stress can increase cortisol, which leads to an increase in oil production. This can worsen existing acne, trigger new breakouts, or even increase inflammation. Pro tip, exercise, practice mindfulness, or just sleep better. Diet. While chocolate doesn't exactly lead to acne, a lot of high glycemic foods like processed snacks and even sugar can lead to an increase in insulin levels, which can then lead to an increase in oil production and worsening of acne. Some people even react to dairy, especially skimmed milk. Pro tip, reduce dairy and refined carbs from your diet to see if it helps. Lastly, skincare and hair care products. Using comedogenic products or even heavy products can lead to clogging of pores. Or if you're over-cleansing or scrubbing your skin too hard, can lead to barrier damage and worsening of inflammation. Pro tip, look for ingredients labeled as non-comedogenic, oil-free or even fragrance-free if you have sensitive skin. Now that you know the types and triggers, let's figure out what you can actually do about your acne. The basics for acne-prone skin should be that your routine is gentle, consistent, and focused on repairing your skin barrier. You have 3 basic steps: cleanser, moisturizer, and sunscreen. When it comes to cleansers, go for gentle, non-stripping cleansers in pH-balanced formulas. Look for ingredients like salicylic acid or even zinc. Remember, you don't need to wash your face more than twice a day. Moisturizers. Yes, even oily and acne-prone skin does need moisturizer. In fact, skipping your moisturizer can lead to an increase in oil production and worsening of the acne. Look for products labeled as non-comedogenic or oil-free. Ingredients like niacinamide, hyaluronic acid, or even ceramides in a lightweight gel or lotion formula for oily to combination skin, or creamier textures for dry skin would be great. And if you want more information on how to read the ingredient label, click on the eye icon. Sunscreens. SPF is non-negotiable even for oily or acne-prone skin. Skipping sunscreen can worsen the PIH or post-inflammatory hyperpigmentation from acne, and in fact, some acne treatments can even make your skin more sun-sensitive. Look for SPF 30 or above with broad-spectrum protection in an oil-free or a gel formula. Key ingredients. Now let's talk about what to actually look for in serums, spot treatments, and prescription creams. Salicylic acid. This is a beta-hydroxy acid or a BHA. It penetrates oil and unclogs pores. It also has mild anti-inflammatory action. Great for blackheads, whiteheads, and even oily skin. Now, how do you use it? It can be used in cleansers, exfoliants, toners, serums, and even spot treatments. Start with 1 to 2 times a week, especially if using leave-on formulas. Then we have benzoyl peroxide. This helps to kill the acne bacteria or C. acnes. It also reduces inflammation and pustules. Best used in spot treatments or in a face wash. Start with a low percentage of 2.5% and then gently increase if needed. Remember, it is as irritating as it is effective. Also, benzoyl peroxide can bleach your pillow covers and towels, so be wary of that. Niacinamide, a soothing multitasking ingredient. This helps to reduce inflammation, control oil, and even fade acne marks. It's very well tolerated even for sensitive skin. How to use it? You can use it in cleansers or even moisturizers and serums. It can be used twice a day, morning or night. Retinoids. These are vitamin A derivatives. They help to speed up the skin cell turnover, improve skin texture, prevent clogged pores, and even fade acne marks. There are various types. Adapalene and tretinoin are prescription, whereas retinol and retinol are over-the-counter or OTC. How to use? Retinoids are available as spot treatments in moisturizers or serums. Remember to use them only at night and with moisturizer so that you can prevent dryness. And don't forget to apply sunscreen in the morning. Pro tip, start low and slow, which means starting at a low percentage and slowly introduce them into your routine, using them once or twice a week if using over-the-counter retinoids. But if you're using prescription retinoids, remember to use them as directed by your dermatologist. What not to do? Sometimes what you don't do is just as important. So here are some common mistakes you need to avoid. Over-scrubbing or overwashing. This can lead to a damage in your skin barrier and worsening of the inflammation. Using too many actives at once. Remember to introduce the actives one at a time. Picking or popping your acne. This can lead to scarring and worsening of the pigmentation. Skipping moisturizer or sunscreen. These are essential in your skincare routine. Remember, acne is complex and can be frustrating, but with the right knowledge, consistent skincare, and sometimes even medical help, it can be managed successfully. Don't hesitate to reach out to a dermatologist if needed. You're not in this alone. If you have any questions, drop them in the comments, and don't forget to like and share this video with somebody who needs it, and subscribe to SSBeauty for more such content. And we're going to do a whole series on acne, so stay tuned for the next video. Thanks for watching. I'll see you next time.